A bold statement for prostate cancer awareness. Should we screen for this common cancer? Let's dive into the latest recommendations and the controversial decisions that have been made. The UK National Screening Committee has recently advised that only a select few men, those at an extremely high risk, should undergo prostate cancer screening. This is a significant development as prostate cancer is the most prevalent cancer among men, yet no official screening program exists. The Campaign for Change, high-profile figures, like Sir Chris Hoy and Lord David Cameron, have been vocal advocates for change, given their personal experiences with the disease. Their efforts have brought attention to the need for better detection methods. What's the expert advice? Experts recommend screening only for men with a confirmed genetic risk, specifically those with BRCA gene variants. This group should be screened every 2 years between the ages of 45 and 61. However, they advise against screening for other high-risk groups, including Black men and those with a family history of prostate cancer. Why such a selective approach? The committee believes that a mass screening program could do more harm than good. The tests for prostate cancer are not always reliable, and can lead to unnecessary treatments with potential side effects like incontinence and impotence. While early detection can save lives, it's a delicate balance, as doctors often struggle to identify aggressive cancers from those that may not cause harm. The controversy: many expected that all high-risk men would be included in the screening plans. But the committee's decision has left some groups out, citing uncertainties and a lack of clinical trial evidence for Black men, despite their higher risk. The same goes for men with a family history of the disease, where the risk of overdiagnosis and overtreatment is high. But here's where it gets interesting: men with specific BRCA variants develop more aggressive cancers at an earlier age. Experts argue that screening this group is justified, as early treatment could improve outcomes and outweigh the potential harm from unnecessary treatment, especially compared to the general population. How do we identify BRCA variants? A genetic test is required to detect mutations in the BRCA1 and 2 genes. These variants affect both men and women, increasing the risk of various cancers. While around 3 in 1,000 men carry these variants, many are unaware unless they have a family history and have undergone testing. The impact of prostate cancer. Prostate cancer is a significant concern, with around 55,000 men diagnosed annually in the UK, and sadly, 12,000 men losing their lives to the disease each year. What's next? A 3-month consultation on these recommendations begins today, and the committee will provide final advice to the governments of England, Wales, Northern Ireland, and Scotland. Health Secretary Wes Streeting has expressed his desire for screening, but only if it's evidence-based. He plans to thoroughly examine the evidence before making a final decision in March. And this is the part most people miss: the impact of these decisions extends beyond the statistics. It's about the lives of men and their families, and the potential for early detection and improved outcomes. So, what do you think? Should we screen for prostate cancer, and if so, who and how? Let's discuss and share our thoughts in the comments.